Namaskar. My name is Dr. Abhijeet Wahegaonkar. I am head of the Department of Hand and Upper Limb Surgery at Sahyadri Hospital, Deccan. Hand surgery has been a discipline that has received uh, more and more attention in the recent years. However, this is a relatively young discipline which started as a niche specialization after the World War II. Prior to that era, uh, hand surgery was not as developed and there were sporadic attempts at dealing with hand injuries or hand problems. It was post the World War wherein there were multiple hand injuries and debilitating hand issues that Dr. Sterling Bundle, an American hand surgeon, gave hand surgery the much needed recognition as a niche discipline. Hand surgery is basically a subspecialization of orthopedic or plastic surgery, wherein surgeons will take further training to deal with any problem of the hand, right from the fingertips to the wrist, the hand, the elbow, the skin, the bones, the nerves, or the blood vessels, and right from birth to old age. The trends in hand surgery are the recent trends in hand surgery involve hand transplantation, pretty much like vital organ transplantation. We also have management and treatment of sports injuries in the weekend warrior as well as the elite sportsman involving small joint arthroscopic techniques. We are able to reanimate and give back function to paralyzed hands and upper limbs, which affect the young working individual in road traffic accidents or even after birth, wherein children will develop paralysis of the upper limb during birth. We are also trained to deal with any complex or complicated problem of the hand and the upper limb, right from infection to post-burn contractures, malunited fractures, deformities, and so on and so forth. 1 out of every 3 patients that comes to the emergency room will have a hand injury. This may range from a simple cut to a complex, debilitating crush injury. We need more and more training centers. We need more and more structured curricula to train the future generation to deal with these injuries. Unfortunately, unlike joint replacement surgery and spine surgery, hand surgery is still in its infancy, especially in our country. There are programs and there are universities across the world that have taken due recognition for the need of training hand surgeons, and they have curricula and structured fellowship and training programs that have the ability to create the future generation of hand surgeons. We as well have taken that recognition and we also have started these programs. But for a country of 1.3 billion, a lot more has to be done to be able to cater to the needs of our patients. For this, we need to have government recognized programs, we need to have subspecialty training programs, and we need to have an initiative from the educational sector, the medical education sector, to create the next generation of hand surgeons. We are a team of 6 extensively trained hand surgeons who work as a team and offer our patients the best of care for hand and upper limb problems. Be it a child who is born with congenital hand deformities such as an absent thumb or fingers stuck together, or a crooked hand or a crooked wrist, to paralysis of the upper limb, crush injuries, industrial and road traffic accidents, people who are working in the software industry having nerve related problems. So we deal with it all. We have a multidisciplinary approach comprising of hand surgery team, physiotherapists, occupational therapists, orthotists, prosthetic specialists, psychologists and psychiatrists, pediatricians, neurosurgeons, neurologists, and a very good anesthesia team to provide the best of all services for our patients. So besides all these services, we are in the process of initiating a hand transplant program in the very near future, wherein we'll be able to offer hope to patients who deserve or who qualify for these surgeries, especially bilateral amputees, wherein there is no hope of having a meaningful hand function. So we are very excited about this wonderful upcoming opportunity, and we look forward to serving our patients with this facility as well.